Communications Officer for Contra Costa Health Services. Appreciate you all joining us today. I'm here with Dr. Chris Farnetano, who is the Health Officer for Contra Costa County. He's going to just a little bit about how this is going to work. He's going to make some opening comments, and then we'll take questions. If you'll drop your questions in the Q&A, we will monitor that. If you put them in the chat, we will at the end of the event get to questions in the chat. But if you want to make sure that we get to them in a timely, quick manner, please put them in Q&A. We will be recording this meeting. It's already being recorded, and we will make the recording available via our YouTube channel about 30 minutes after we're done, so that will be available to you there. And we will drop the link to our YouTube channel into the chat here in the not too distant future shortly. So I'm gonna turn my camera off so you all see only Dr. Farnetano, and then I'm gonna turn it over to him, let him make his opening remarks, and then I'm gonna come back and read the questions to him so that he's the only one on screen. So give me a second, Dr. Farnetano, and then when you don't see me anymore, I'll let you take it away.
Thank you for joining us today. On Thursday, California reached the unfortunate milestone of 1 million COVID cases diagnosed statewide. Around the country, COVID cases and hospitalizations are on the rise again, with a new wave bigger than the previous ones. For a while, the Bay Area resisted this trend. That is no longer the case. COVID hospitalizations in Contra Costa have returned to levels we have not seen since September. On November 11th, 50 people were in the hospital due to COVID in our county, the highest number since September 25th. Given this rapid increase in COVID transmission, we must act quickly. That's why Contra Costa and other Bay Area counties are tightening up on local rules for high-risk indoor activities where the virus can spread more easily. So effective Tuesday, November 17th at 8 a.m., the following businesses in Contra Costa County must close: indoor dining, indoor gyms and fitness centers, and concession stands at movie theaters. We chose these activities because of the risks involved. For instance, diners at restaurants remove their masks to eat or drink, as do movie patrons when snacking on food from concession stands. While masks are one of the most effective prevention tools, heavy breathing due to exercise, even with a mask, can transmit virus particles very long distances. As we approach the holidays, I want to remind everyone about two very important health recommendations. Number one, outdoors is safer than indoors. If you're going to gather with people from outside your household, please try to do it outdoors. Number two, until there is a vaccine for COVID, your best protection against the virus is to wear a mask when you're around people you don't live with. Face coverings help prevent people who do not know they are infected from spreading the virus to others. My mask protects you, your mask protects me. Masks also provide some direct protection for the wearer. With that said, I'll now take some questions.
Okay, it looks like we have about 20 questions so far. So the first one, what is the basis of closing indoor fitness centers but not other personal care services or non-essential businesses? Are there specific documented cases of community spread linked to indoor fitness centers? If so, how does that compare to other businesses that are allowed to remain open?
We have seen, looking across the country and across the state, there have been outbreaks in gyms and other fitness centers that are concerning. The very nature of the activity there, where people may be breathing very heavily, can have air exchanges 10 times the volume of someone who's just breathing at a normal rate, and that can spread virus. Again, even with a mask, the mask will reduce that, but it will not eliminate that risk. So that's why gyms are an identified high-risk setting for COVID transmission.
Next question. I was hoping to get some clarity on process. It was my understanding that announcements were made on Tuesdays around midday, and that would inform our actions regarding what restrictions we were to comply with. It's a bit frustrating to have that switch and now an unexpected announcement and varied timeline for us to comply with. How can small business owners expect in the future what can small business owners expect in the future as we move through the next weeks and months?
The state does have a cadence for announcing their tier movements on Tuesdays, which go into effect on Fridays. But this virus is moving so rapidly, and this virus does not respect the calendar. So we felt it was critical to take action now and put in these restrictions within a few days and not wait until a particular calendar date to take this action. We saw in the spring that days mattered in putting in those restrictions, and a matter of days can lead to fewer cases, fewer hospitalizations, and more lives saved.
Great. Next question. I'm a registered dietitian in Walnut Creek and was wondering if you are concerned about the mental health, stress aspect, and other public health outcomes in the future of closing fitness centers, further lockdowns. It seems a bit short-sighted.
We are concerned about all the effects COVID is having, all the decreased interactions, social interactions, and the mental health impacts of that. We're trying to balance all these concerns against the very lethal virus that is ravaging our communities. There are alternatives to exercise, that people can exercise outdoors and exercise in their homes and do it in a way that doesn't lead to COVID transmission. So we really have to try to balance these things, but right now we really need to take strict action due to the rapidly rising rates of COVID in our community.
Just a quick reminder, if you have questions, to drop them in the Q&A. We will monitor chat at the end of the event, but we are taking questions from Q&A, so use that function, please. What is the communication strategy directly with business owners who are affected? I'm reliant on tuning into the weekly updates on Tuesdays, as well as my very active membership base to help keep me informed of updates such as today's. So Doctor, let me know if you want me to take a little bit of that, but I know you're deeply involved, so go ahead.
Sure. We do have our environmental health division that works very closely with our restaurant industry, and they'll be working to make sure our restaurants are aware of the new changes and the new restrictions. And so we'll also be working with city managers and other local elected officials to help them get out their channels to their local businesses. Anything you want to add, Kim? Or?
I would just say that we're working on an employer's toolkit that will be rolling out over the coming weeks through chambers of commerce and business associations. So we're hoping to better develop that relationship. We do understand the impact that this has on small businesses, and we are concerned about that impact. And so that is definitely a channel that we are looking to expand. So thank you for that question. I wanted to know why you were shutting down entire sectors of business, moving the goalposts when you could enforce existing rules. You have not been enforcing requirements. They enforce seatbelt rules. Why not COVID rules?
We do have an enforcement sector, and enforcement of the current rules is important. We do work with cities and county agencies, our district attorney's office, and other code enforcers to help with local enforcement. But clearly, this is changing so rapidly, and the enforcement efforts so far have not proven sufficient, and the current restrictions have not proven sufficient to prevent a surge. We do really ask everyone, both individuals as well as business owners, to follow the guidance, especially the social distancing and the mask wearing. And the more we can follow this guidance and the more we can wear our masks and stay away from others outside our household, the more effective we're going to be in keeping this surge smaller and of shorter duration.
If I am reading the new announcement correctly, it states that indoor fitness facilities must close as of 8 a.m. this coming Tuesday. Are we able to operate outdoors?
Yeah, outdoor fitness operations are still allowed.
You addressed this one a little bit, but was the decision to close dining and fitness centers based on empirical evidence of transmission in those facilities?
It's a combination of what we're seeing as far as local reports, statewide reports, and nationwide reports of where transmission is happening, as well as lots of modeling and scientific understanding of how this virus spreads. And we certainly know that indoor dining is one of the business sectors that is highly associated with outbreaks, and the very nature of dining, where people have to remove their masks to eat or drink, poses a particular risk.
How long is the shutdown for indoor gyms going to last, and will you allow outdoor gyms to reopen?
Again, we are allowing outdoor gym and fitness activities. This current order does not have a endpoint. We are going to be driven by the data. And when our numbers improve and our hospital cases come down and our case rates come down, that's when we will look at lifting these restrictions.
So I think, Dr. Farnetano, I'll just ask this question a little differently than it's written here. We strongly suggest the need to wear masks, but in the case, for instance, of fitness centers where people are exercising and breathing heavily, I think there's some confusion about whether masks are effective there or not. So maybe you can talk a little bit about the effectiveness of masks in exercise and also singing and performing in some of those kinds of settings.
Yeah, most of the research shows that when people are breathing normally, talking at a normal voice, they can spread COVID-19 particles, these small droplets that come with normal speaking and breathing, as far as 6 feet. If someone is singing or exercising and breathing heavily or shouting, that distance increases for 9 or 10 feet. And so while the mask, we know that masks can reduce a lot of those particles, the increased volume of the particles and the increased distance they travel is less able to be reduced by a mask than when someone's just breathing normally. So the mask, it does not provide the same level of protection when you're around somebody who's breathing really heavily and exercising as it does when you're near somebody who's just breathing normally.
A quick reminder at this point that if you'll drop your questions in the Q&A function, that's where we're taking questions from right now, and I'll be reading them throughout the course of this event. Just Tuesday, you announced rollbacks. What has happened since Tuesday to force you to add additional rollbacks?
We are looking at the data every single day, and as each day goes by, the data gets more and more alarming. Our case rate now are over the last 7 days where we have good data, which is we're using about a 7-day lag on that data. Our case rate is already into the purple tier, and our adjusted case rate, where the state lowers that case rate based on the fact that we are testing at higher levels than the state average, even our adjusted case rate is still in the purple tier. And when we look at cases in the last few days, which are still trickling in from some late reporting, we're seeing that trend even continue. And we also, when we look at our hospitals cases, we are seeing in the last few days that trend continue to increase on the number of people in the hospital. So from Tuesday to today, we have become even more concerned about the trend.
It seems that the state of California had an evidence-based system in place that defined metrics for meeting the qualification of each tier. Since you have decided to create your own rules, what metric must the county meet to allow these businesses to reopen indoors?
As I've said all along, the, the state's blueprint for a safer economy, which is the 4-tier blueprint that they created this summer, is a very good approach, and it does have adjustments based on the level of community spread. But one of my concerns about that from the start was, while it was appropriately cautious to slowly open up and requiring several weeks of improving data and declining case rates to move a county to a less restrictive tier, it was too slow to ramp up those restrictions. And we know how quickly this virus can get out of control. We've seen it happen locally, other parts of the state. We've seen that happen in other states in our nation. And we know waiting, when we know we're going to be in that purple level of case rates, waiting several weeks to put in those restrictions, there's no need for that, and that just is going to make this wave that's coming, it's going to make it bigger and longer lasting. So if we can put in some of those key restrictions now, we can hope to blunt that wave, blunt that surge, keep it from being so big and so long lasting, and get us through a winter surge quicker and with less harm to the community in terms of severe illness and death.
If grocery stores can remain open, why can't restaurants and bars?
There's very key differences between those types of businesses. People can wear masks in a grocery store. They can remain 6 feet apart from other shoppers in a grocery store. However, in a restaurant, by their very nature, people are eating and drinking. They are taking their mask off. Restaurants are often also very crowded areas where it's harder to maintain physical distance. So there's some key differences in why restaurants are a very high risk setting.
Are church services impacted further?
Not at this point. We did institute restrictions last week on church services that were in line with red tier level restrictions, limiting to 25% capacity indoors and a maximum of 100 people, whichever is less. We are continuing to watch the data, and we are prepared to add additional restrictions in the future if our cases and our hospitalizations continue to rise, even in advance of the state making those restrictions. Again, I said we are already reaching purple tier level criteria, and if that data holds, next Tuesday when the state puts out its numbers, we will likely reach our first week of qualifying for the purple tier, which means the following Tuesday, the state will officially move us into the purple tier, which means all those purple tier restrictions would then go into effect the day after Thanksgiving. But we may not decide to wait that long to add additional restrictions if we're looking at our numbers on a daily basis and seeing that rise continuing.
So you've answered this a little bit, but as the county is preemptively closing businesses on Tuesdays, are there specific indicators that the county is looking at before making the decision to reopen indoor businesses?
We're looking at our data on a daily basis. We're looking at how our cases are going up or going down. We're looking at the test positivity rate. And we're also looking at our most impacted communities. How are those communities being disproportionately harmed by very high case rates and hospitalization rates compared to other communities? These are communities where there's a lot of essential workers and there's a lot of folks who live in larger households, and so there's they're at higher risk of spread. So we're looking at our hospitals and how well they are prepared. It's not just hospital beds, it's not just ICU beds and ventilators. It's how is their staffing? Our healthcare workers have been working tirelessly for months, wearing masks and wearing face shields and caring for COVID patients, and they're all exhausted. And we're seeing other parts of the country getting shortages of nurses, and a lot of hospitals rely on nationwide nurse staffing agencies to keep their hospital staffed. So we're looking at, are these hospitals being able to maintain their nursing staffing? We're looking at critical intensive care unit medications that are now in high demand and could be running in short supply. So we're looking at all those different factors. We're looking at, do the healthcare workers have the personal protective equipment? We had big shortages in the spring. We're doing well right now with good supplies and good access. But if that changes, that will be concerning as well. So we're looking at how this is affecting our communities and how this is affecting our healthcare system, and putting all that together and looking at our decisions of when we can start opening things back up again once we get through this current wave.
By closing indoor dining, concession stands, and indoor gyms, do you feel that this is the most effective manner in reducing cases in our county, and will it be enough?
These are the current business sectors that we are the most concerned about because of the very nature of activity in them. These are sectors, by restricting them, we think will make a big difference in our community spread. Will it be enough? I am not sure. We will have to watch the data and see. I'm hoping these will be enough, and I'm hoping the message that's going out that we all need to do our part to wear our masks and to limit our gatherings and to maintain our 6 feet of distance between others outside of our household will really be followed even more than our community is following it now. And all those things together will make the difference. But if it doesn't, we are prepared for even further restrictions.
How close is Contra Costa County from moving from red to purple?
Well, like I said, it is possible the state may move us into purple as soon as the Tuesday before Thanksgiving, which means those business restrictions would go into place the day after Thanksgiving, that Friday.
Why do you not believe in herd immunity?
Herd immunity is something that would take an enormous toll on the community and would lead to enormous number of deaths, far more than the number of deaths that we've seen so far. Most estimates say that even after these multiple waves of COVID that we've seen across the nation, most communities have 5 or 10% at best of the community that has antibodies to COVID. And we're not even sure how protective those antibodies are. In order to get to a level of herd immunity where we could stop wearing masks, stop social distancing, and remove all these business restrictions, most scientists expect we would need 70 to 80% levels of herd immunity. And that level of disease, it would take uncontrolled disease going on for months and months and months with untold numbers of deaths in our community, and the price is just too high.
So in terms of movie theater concessions, is the goal to have movie theaters prevented from serving any food, or is it simply to preclude the group gathering and standing around at the snack bar?
Ideally both, but it's mostly focused on making sure people are wearing their mask through the entire movie theater experience. So they're not taking off their masks to eat or drink. And so just like indoor restaurants, we don't want people taking off their masks to eat or drink indoors in a restaurant. We don't want them doing it indoors in a movie theater.
Is this decision based on what's actually happening in our county, or what might happen here, or what's happening in other Bay Area counties and elsewhere?
We're really looking at all of it. There's a lot of studies nationwide, and it matches our own local experience. That when our case investigators talk to individuals and try to figure out where they caught COVID, many, if not the majority, can't pinpoint a specific location, because people are out more and they have multiple potential opportunities where they may have been exposed. But in those situations where we are able to identify a business setting, both locally and what we're hearing from our colleagues across the state and what we're reading in studies and reports from across the nation, fitness centers, movie theaters, and especially restaurants keep coming back as settings that outbreaks can happen.
Why can't we just protect the vulnerable and allow the rest of us to get back to living our lives?
That would be an ideal strategy if it would work, but it can't work because the vulnerable can't live in a pure bubble. We've seen that in our nursing homes. Our nursing home workers, they leave the nursing home every day to go home, to go shopping, to go be with their families, where they can be exposed and they can bring that into the nursing home. We have an extremely aggressive protocol that we've been working with nursing homes and assisted living facilities for the elderly, where we're requiring the staff to be tested, we're requiring PPE to be worn, we're requiring isolation of people who are newly admitted to those facilities. We've got a whole series of steps in place. We're limiting gatherings within the facilities and outside the facilities. There's a lot of steps there. It's making it difficult for those residents because they're being limited from some of their social interactions. But even with all those steps, there are still cases in those facilities. There are still outbreaks in those facilities. They're fewer and they're smaller sized outbreaks, but they're still happening, and deaths are still happening in those individuals. So we are not able to have a pure wall of protection for those individuals. We've done better with what we've learned and what we're doing, but the best way to protect our most vulnerable members of our society is to keep the overall community transmission as low as possible.
We are continuing to see large increases in cases from cities such as Richmond, Antioch, Pittsburgh, San Pablo, Concord, and Bay Point. What are we doing to address this?
So this past week, we had a community testing event where at our West County Health Center in San Pablo, which is one of the hardest hit communities, we paired with lots of community organizations, many from the Latino community, to help get the word out and encourage local residents come out and get tested. We had over 400 people come out and get tested. We think 3/4 of those individuals were people who had never been tested before, so first-time testers. And there was a high positivity rate among those people coming out, which means we were really reaching people who really needed testing and were benefiting from testing. So we're looking at more events in other hard-hit communities. We're really working with community groups to figure out what's the best way to use trusted messengers from community organizations to get the message out, so that people hear it from someone they trust and someone they will listen to.
So back to gyms, what about limiting indoor gym activities, allowing access for strength training and stretching, but not cardio?
We are really putting these restrictions because we're trying to mirror some of the state guidance so that we are keeping our type of guidance for different industries as close as possible to the state, but just adjusting at what kind of tier level it is. And so we're trying, we hear from businesses that it is confusing, that there's a complex guidance document at the local level that may differ from the guidance document at the state level. So we're trying to keep it very sector specific and trying to keep it, while we may be moving into purple level restrictions quicker than the state is, we're trying to keep it matched with those similar levels of restrictions that the state has set tier by tier. So trying to keep it a little simpler and easier for businesses to follow.
Case numbers for the state have at least a week or so lag. Based on current numbers for the county, do you anticipate Contra Costa County moving to purple tier next Tuesday?
Again, as I have said, we anticipate when the state's numbers come out on Tuesday, we will likely be meeting purple tier criteria. The state's framework says a county has to meet purple tier criteria for 2 consecutive Tuesdays. So if we do meet it next Tuesday and the following Tuesday, we will move into the purple tier on that following Tuesday.
Regarding the rules for schools, does this mean a single school that currently has a small number of students on campus for like special ed or specialized services can open the school to the whole student body? Or is the rule that those classrooms that are open now can remain open in purple, but new classrooms cannot open?
The state guidance about counties moving into purple tier is school campus specific. It states that if there is a school campus that has brought at least some of their students back on campus for in-person learning, before a county moves into the purple tier, they may continue that in-person classroom learning. And if they have a reopening plan that is planning to add additional students, additional grades, they can continue with that. It does state that the school must begin testing their staff, or they've already been testing their staff, intensify the frequency of testing of their staff. We currently recommend teachers and other essential workers get tested at least monthly, so that the schools can quickly detect any cases or outbreaks in the school. If a school that has opened, at least partially, for in-person learning is continuing and they are not seeing cases and outbreaks in their school, they are allowed to continue. There is a framework that gives guidance to schools that when they have outbreaks, when they need to close a classroom, or due to multiple outbreaks, when they may need to close the entire campus.
So let's talk a little bit about sort of personal care services, particularly those that involve the face, cosmetic procedures that require somebody to take off their mask. Where are we at those?
Those are still allowed, although the state guidance says that if you're getting a personal care service where the customer has to remove their mask, so for some kind of face care, the person providing that service, not only should they be wearing a mask, they should also be wearing a face shield for extra protection for both the worker and the customer.
What specific areas in the county are spiking?
We are really seeing rising community transmission across our county. West County, East County, Central County, South County, the La Marinda corridor. Our hardest hit communities are getting hit even harder now. But even the communities that have had low transmission rates, we're seeing their numbers rise significantly. So it's not really sparing any community in our county right now.
So why not just go to purple restrictions for all businesses rather than pick only a couple to restrict? Won't this slow the process of getting the spread under control?
We may consider moving to a full purple restriction sooner than the state, but we felt these key industries really, based on the science and our experience, are the highest risk, both because of the nature of their activities and the high number of people that are involved throughout the county in going out to restaurants, going to gyms, going to movie theaters. So we felt that these three key restrictions would have the bulk of the impact of the purple tier level restrictions for our community.
Can you test positive for COVID if you have a cold or the flu?
There have been some studies in children recently that have shown that some children can test positive for antibodies for other coronaviruses, and some common cold viruses are coronaviruses. They're in the same family of COVID. So there's some cases being reported of small children who haven't had COVID who get an antibody test that tests positive. Because these antibody tests, some of them will react to other coronavirus antibodies. That's very different from the tests for the virus. We have two tests now we use for the virus. One is a PCR test, very, very sensitive. And then we have an antigen test, which is some of the rapid tests. That test, not quite as sensitive, but both of them are very, very specific for COVID-19, the virus that we're worried about. They do not test positive when you have a cold or a flu or some other kind of respiratory virus. And they're very, very specific. We see very, very few false positives in those tests.
So who enforces mask compliance with citizens in public? I know you talked about this a little bit, but maybe you could talk a little bit one more time about enforcement.
So when it comes to businesses, there's several different agencies that are involved in making sure that customers and employees are wearing their masks. And so cities have code enforcers, and our district attorney's office is involved, and we have other agencies like environmental health that regulates restaurants are involved. For when it's outside of a business, when it's a gathering that may be going on, then that falls to more local police agencies to help with the enforcement effort.
Is there any impact to outdoor dining?
Not at this point. So outdoor dining is still allowed, and it's allowed even if we move into the purple tier. The state does define an outdoor dining experience to include having a covering and a tent that can have up to one wall closed off, but it still needs 3 open walls to be considered an outdoor dining experience.
What about office workspaces? What are you recommending where office workspaces are concerned?
Well, first of all, strongly recommending that people work remotely whenever possible, and really only have the bare minimum number of workers who are really required to actually be in the office to keep the office functioning. If there are people in that office, if they're in the same room, wear a mask, stay 6 feet apart, really do your conferences and meetings virtually and not in person. One of the biggest risks is break rooms. People being very good during their daily work, wearing their masks and staying away from others until it comes to the lunch break, when they go in a break room and take off their masks to eat or drink and get close to their colleagues. And so really be extra cautious around break times, lunch breaks, making sure if you're going to eat or drink and remove your mask, to do so that you're far apart from other people, preferably outdoors.
Why are indoor pools closed?
So indoor pools are closed as part of the red tier restrictions that were imposed by the state on Tuesday when we moved into the red tier. Indoor pools are higher risk than outdoor pools because of the nature of the indoor air environment. There's less air circulation. When people are swimming, they are taking off their masks, and so they're breathing and sharing virus particles potentially in that indoor air. And so that's why the state allows outdoor pools in the red tier, but not indoor pools.
When answering questions, you keep referring back to state guidelines, but have chosen to restrict certain businesses that under state guidelines should be open unless in the purple tier. Why is that?
As I've said, the state framework is a good starting point, but we are concerned that the state framework doesn't react as quickly as is needed to scale back some of these restrictions when the cases are heading the wrong direction, the hospital numbers are heading in the wrong direction. And so we've chosen to act quicker than the state. Last week, we knew we were heading for red tier, so we instituted the most critical red tier restrictions a week ahead of the state doing so. Now we're instituting the most critical purple tier restrictions in advance of the state doing so, because time matters with this virus.
Great. I think all the other questions that are left in our Q&A function are topics that we've covered a couple of times even, but let me take a pause to make sure that that is actually the case. So there's one question, we sort of touched on this, but med spas. Why are med spas being kept open during this time?
There are certain things that under, there's clear medical supervision that can occur where they can't occur outside of a medical setting, like medical spas and medical massage therapy. And that's because they are part of medical treatment, and with that medical supervision, they can often put in extra precautions about making sure there's social distancing and hand hygiene, and those are often one-on-one services too, which also have less risk than when people gather for the same activities.
So Dr. Farnetano, I think it would be helpful to end today with a little bit about sort of the regional approach that you and the other health officers have been taking, and kind of how that's evolved over the many months that we've been in this situation. And so I think it would be helpful to talk a little bit about how that process works and how in touch you are with those other health officers, and how we're really looking at this from a regional perspective. So I'll just kind of give you that open-ended question and let you address it as you like.
Thanks. Yes, we know that the Bay Area is one big human ecosystem. There's people who live in one county and work in another, and they go out to a restaurant in a third county and may shop in a fourth. And there's so much interaction that it really is important for us to try to coordinate our activities. And I talk with health officers from across the Bay several times a week. In the last couple of weeks, it seems like it's been several times a day, where we are talking about our approaches and our local data and what the data is looking like across the Bay. We're all concerned. We're all looking at steps to tighten up our restrictions to try to get a handle on this new wave that's coming. San Francisco is closing indoor dining effective today. Santa Clara is also closing indoor dining They made that announcement today. I think it will be effective at on Tuesday as well. Marin County is taking similar action. I know other counties I've been talking to are strongly considering similar action. So we really are trying to think together, strategize together, and as much as possible, act together, because it is one big human ecosystem, and what happens in one county affects the neighboring county.
Well, Dr. Farnatano, I want to thank you for taking the time today to be with us. I think all of it looks like at one time we had a high of 80 participants. So I want to thank you all for taking the time to be here as well. We really appreciate it. We know that this is a tough time. We'll continue to do our best to keep in touch with our community and let you all know how it goes. I'll close just by saying, please wear a mask. It is really the one thing that makes a difference. Thank you, Dr. Farnatano, and wish you all a good Friday afternoon.
Thank you, Kim, and thank you all the participants.